Well, I'll introduce myself. My name is Sheron Robson, and I'm one of the program managers at the Northern Cancer Alliance. My role there is to focus on the early diagnosis of cancer, innovation in cancer, and to try and drive down the health inequalities that we have across our patch. Given that the biggest challenge that the NHS faces as a whole is workforce, both clinical and administrative, RPA gives us a way to address that because we can bring in the robots who can become staff who can work 24/7, never go sick or never take annual leave. And in terms of cancer pathways, every day on that cancer pathway matters. Our NHS trusts require a more efficient way to manage the data and audit key milestones within the various cancer pathways. And those cancer pathways were extremely challenged during COVID. We're seeing an ongoing increase in referral numbers, so more and more people are on those cancer pathways. And the targets have increased the workload of the cancer tracking teams and reduced the effectiveness of their current processes. These changes have rendered staffing levels too low to provide the frequency of pathway monitoring that we need to support effective pathway coordination. So why we chose Blue Prism was a variety of reasons. One being the fact that Blue Prism has the largest market share in the NHS, with over 85 NHS trusts already using their platform. They have a library of pre-written processes that can be shared and adapted to individual trusts. And the service is provided as software as a service. So our trusts don't need to get IT to buy, build, and manage their infrastructure. And we know from having worked with them now that they understand healthcare and the cancer clinical pathways. But I feel this work has the potential to massively, positively contribute to cancer patient pathways. So a couple of examples. In North Cumbria, the digital workers will check on the electronic referral system for 2-week waits that are directly booked from primary care, and then we'll transfer that data onto the PAS system and onto Infoflex, which is the cancer management system, to ensure that the patient record shows the appointment, the patient is added onto the cancer pathway, and then can be tracked through that pathway. It's estimated in North Cumbria that this has saved 50 hours a week of cancer tracking time. It's also reduced the transcription errors in getting people onto that system quicker, and has had a positive impact on their 2-week wait referral standard. Also in North Cumbria, they've automated their lower GI cancer pathway for straight to test, with approximately 70% of their 2-week wait patients on the colorectal pathway going straight to test to endoscopy this year. This process picks up those patients with the digital workers checking the status of patients that have been appointed on the straight to test to endoscopy, and update the system as to whether the patient's pathways have closed or what the planned next steps are. Now, in this case, this information was not previously collected, but it does form part of the nationally mandated COSDI data, Cancer Outcomes and Services dataset. So consequently, North Cumbria's data quality has improved, and both they and the Cancer Alliance now have oversight of the activity and the performance to inform our strategic decision making and resource allocation. It's estimated that this process has saved the team there 24 hours a week. And my final example from Gateshead is where we've used automation to pull together all of the preparation work for the breast MDT, multidisciplinary team, which is now automated, and that frees up the cancer tracker to focus on navigating patients through the cancer pathway who otherwise would have breached the standard and been delayed in their cancer treatment. We know that there is lots of variation across our 8 providers, so we can use automation to really drive out that variation in the system. And a couple of things that are more in the developmental stages, we're talking to one of our other trusts, Northumbria, about using their established Blue Prism RPA team to think about what they could do to support the writing of processes across our alliance. And also something that we are trying to tackle, which is a major challenge for cancer services, is being able to give back to the National Cancer Team the data that they need around the usage of FIT in the colorectal pathway. This has been a massive challenge and a massive extra challenge to our cancer tracking teams. There's huge national focus on this because there's been huge investment, and we need to be able to demonstrate that that investment has paid off. But it's this, if we can write a process to capture the data for FIT across our alliance, it potentially has a massive benefit to any provider that has a colorectal cancer pathway, because we're not the only alliance that needs to collect that data. It needs to be delivered nationally. So, as I said in the beginning, the biggest challenge to the NHS at the moment is workforce. Here is something that can positively contribute to the delivery of the tracking on our cancer pathways in a way that doesn't involve recruitment.